Hi guys, Rena Malik here. I'm a urologist and pelvic surgeon, and today I have my very good friend, my sister from urology residency, Dr. Fenwa Milhouse. She is from Chicago, Illinois at Dupage Medical Group, an excellent urologist and an amazing social media person. You got to follow her on Instagram. Her handle is
At Dr. Milhouse with one L, so at Dr. Milhouse.
Yes, and so she's got amazing stuff on there, stuff for women physicians, stuff for medical students, stuff for just being living your best life as a mom, as a person. So really great stuff. So today we're gonna have some real talk, some kind of deep stuff about how we handle complications. And complications are just a nature of being a surgeon. Why don't you talk a little bit about how you handle a complication?
So first, thank you for having me on your channel. I love your channel. Make sure you guys hit the like button and subscribe. Great stuff. But yeah, complications are a real deal thing that we deal with in surgery, and it's not something that we openly talk about. So I think it's important to. Complications are the least favorite part of our job, but if you're doing surgery, you're going to get a complication. How I handle it, first and foremost, it's important to be very, very honest with the patient and the family about what happened. Now, that's not the time to kind of play it down or sugarcoat things. I want to be an open book. I want to be very available to the family members and to the patient. So I make sure that they can reach me very quickly and easily because they're going to have questions, they're going to have concerns, and they want to feel like they're supported. And I express my own regret and my own apology for what happened. I will say, I'm so sorry this happened. I'm sorry that this occurred, and I feel bad about it. And I think it's important just for the family to hear those words.
Yeah, absolutely. I think the truth of the matter is that it's hard for us to deal with complications too, and we feel extreme regret. We feel really sad about it, to be honest. I mean, we go into this field, we go into surgical fields to help patients and to really do the best we can for our patients. So it's a really hard and challenging thing, and we that's why we go through all that before surgery. We talk about all the things that could possibly go wrong, and unfortunately you could end up in that 5% of patients who has something go wrong.
Yeah, absolutely.
Yeah.
What are some of the hardest conversations that you've had so far in your practice with complications, and what words have you said to family members or the patients?
Well, I think I try to give information about what happened, why this happened, be very open and honest with them, and just be really, really available to them. As you mentioned, like, they can come see me anytime, they can message me anytime, and see them often after it happened to really
Yes.
just don't shy away from it.
Yes, yeah. I think that last point that you brought up is really excellent. When complications happen, you don't want to avoid the family or the patients or not check in with them. That's when you really actually want to kind of be very available again for them and go see them and check on them. Whether it's, hey, visit them more often if they're in the hospital during that. Or just calling them and saying, hey, how are things going? So it's what are the kind of the emotions that we go through as on the physician side of things when we are dealing with complications.
Yeah, I wish we talked more about this. That's why
Yeah.
I think this was a really good idea for us to do, because I think it's extremely isolating. It's extremely isolating to have a complication because you feel like there's only so many people you can talk to about it openly,
Yes.
because it's a sign of weakness or a sign of imperfection, and so a lot of us are perfectionists and type A personalities and want to do everything perfect, and so it becomes very isolating. It becomes very lonely, and it disrupts your sleep, it takes over your life, and it does that for a few days or a few weeks or a few months, depends on the complication, but it's definitely something that takes a toll. What about for you?
100%. Um, I, as we as physicians, even just talking to sometimes your colleagues about it, you still put up kind of a front that you have it all together. But the fact of the matter is, this complication might really be kind of you might be second guessing your own abilities, or your own skills, or what you did, and that you need to talk that out with somebody. And it's kind of hard to do sometimes in our profession. I definitely have lost sleep over something that went wrong with a patient, and just kind of racking my brain, trying to replay things out, trying to figure out how I can help the patient get past the complication, and also just lost sleep thinking about what the patient's going through and what they, you know, uh, worried about what they might think or do to me. I mean, unfortunately, in our current environment, there is a real concern for patient retaliation.
Yeah, yeah,
Um,
that's a
you
real
know,
concern.
physical harm even. Thankfully, that's not been my experience whatsoever. But I think
Yeah.
there was a case when we were in residency of a patient whose son went and shot the pulmonary cardiopulmonary surgeon.
Yeah, in
So
Boston, right? I think,
yes,
yeah.
yeah.
And
So
in urology, there's actually been a couple people who've had scrotal pain after vasectomies and
mhm.
shot, or at least tried to attack urologists.
Wow,
Yeah, I think in California there was a case
wow.
of this.
Yeah, so that is a real legitimate fear when things don't go well and patients are understandably upset, but you are, I've lost sleep again, worried about my own physical safety. And how do you get over it?
It just takes time. Yeah, at
Yeah.
least for me, I think it has to take its course. I do talk to my mentors or close friends, like I've talked to you about things, and I think it helps. It helps, and it's a safe space that you can talk to those people, and that you're not going to be judged, and so it helps me. I talk to my partners.
Yeah.
I talk to them a lot, and they help me. They support me. So I think it just takes its course. What about you?
I try to also, again, talk to my mentors. I definitely have of my partners who are very supportive, and a select few that I can really just open up to. I
Hmm.
talk to my husband too. I mean,
Yeah.
he's not a physician, but he is definitely a good listener and understanding. And I fall back on, my own personal beliefs, prayer, and I try to learn from what happened, and whatever the case may be, try to see how I can be a better physician for the next person.
Yeah.
But it definitely takes time for sure.
I agree.
Yeah.
I agree. Well, I think the nicest for this talk for us was we really we were kind of on social media and seeing a lot of things through rose-colored glasses. Everyone's living this
Mm-hmm.
glamorous, wonderful life, and everything's going great. And we wanted to bring it to light that it's not always like that, and that's okay. That's
It is
normal,
okay.
and it's a part of work and life and everything. So it's not always perfect, but that's okay.
Yes. I mean, social media is definitely very rose colored. It's not always the true picture. You're going
Yeah.
to see the best of a person. And so it's very easy to get caught up in thinking, well, maybe it's me, like I'm inadequate or I'm not,
Hmm.
and the
Hmm.
truth of the matter is that is not true. We all have gone through ups and downs in patient care, and with managing patients and dealing with that. So I love that you are just being honest about this
Yeah.
on your YouTube channel.
Well, thank you
Yeah,
for
I think
joining
it's
me.
yeah,
It's
absolutely. I think
great.
it's a little brave to be, to be honest, to have your physician name, and just say, listen, we've dealt with complications. This is what we go through,
Hmm.
on the physician side of things. So.
Yeah. Yeah. Well, thank you guys. I hope you enjoy this. This is going to be completely unedited and just real talk. And so
Mm-hmm.
if you like this, please let me know. Comment below if you like what you saw, and make sure you let me know if you want more of this. I do tend to see Dr. Milhouse every year, at least once a year. So we can always do this.
Yes.
And we love hanging out together, and on camera, why not?
I love you.
Love you too. All right, guys. See you next time.